We begin this morning with the news not only shaking New York, but sending shockwaves across the country. Governor Andrew Cuomo is resigning from office amid a cascade of sexual harassment allegations.
The three-term governor says he's stepping down in 2 weeks' time. The governor's announcement came 1 week after New York's attorney general released a scathing report on those allegations, prompting politicians on both sides of the aisle to call for Cuomo's resignation.
I think that given the circumstances, the best way I can help now is if I step aside and let government get back to governing. And therefore, that's what I'll do.
The news in Albany overshadowed the president's victory lap at the White House yesterday. Reporters asked President Biden about the resignation, all while he was touting his signature infrastructure legislation passing in the Senate.
What impact, as the head of the party, what impact does his resignation have on the Democratic Party?
I think the impact is all on Andrew Cuomo and his decision to make that judgment, and I respect his decision.
Lieutenant Governor Kathy Hochul is now set to become the next governor of New York. She'll be the first woman ever to lead the Empire State.
The surprise resignation does not mean the legal and political fallout swirling around Governor Cuomo stop immediately. The New York State Assembly began an impeachment inquiry less than a week after that Attorney General report alleging sexual harassment was released. And there's no confirmation this morning of whether the process will stop when the governor steps down. In addition, one accuser has filed a criminal complaint regarding the governor's alleged behavior, an accusation he disputes. Here to break down the state of the criminal and legal issues following the governor are NBC News correspondent for investigations Tom Winter and Danny Savalos, an NBC News legal analyst. We are lucky to have you both with us to break this down this morning. Thanks for being here. Tom, I will begin with you now. We don't need to think back very far to find an example of an impeachment inquiry moving forward despite the official in question being out of office already. Now that the governor says he's stepping aside, what happens to the Attorney General's work?
Well, their work from an investigative standpoint is over. The independent investigators, they're done. They have nothing else to do from as far as looking into anything else. The Attorney General's office will be interesting to see if anybody else comes forward, any other women come forward to talk about the governor's behavior or possibly his actions, whether or not they will continue to take a look at things there. But the bulk of their work is complete, except this morning, Savannah, you and I, the governor's attorneys and the lawmakers in New York State all have something in common. That is, we are waiting for the transcripts and the underlying documents from that independent report to be made public. And we should get that hopefully starting perhaps as soon as this week.
And Danny, Governor Cuomo's personal lawyer spoke yesterday to defend the governor. She spoke out against some of his accusers, and she even blasted that Attorney General report. First, let's listen.
What is shocking to me is that the Attorney General's report, which everyone is relying on and is saying is the Bible of truth here, got it wrong. There are omissions. They did not include critical evidence. And there are witnesses that they know lied to them and had credibility issues, and they didn't include that in the report.
So here we're getting a little hint at the way that they're planning to defend this. What do you think of the governor's building legal defense?
The governor's defense showed, starting on Friday, that the report is something that has not been subjected to the crucible of cross-examination or the adversarial process. It may be that everything in there is true, but it simply hasn't been essentially cross-examined. The defense team in a potential criminal case would do their own investigation. They would cross-examine witnesses. And we saw a glimpse of that on Friday. And we're seeing it with Ms. Glavin's interviews here. She's right. I mean, it is, as we say in the criminal defense business, only one side of the story.
And now, Tom, there is a criminal complaint, as I mentioned, against the governor. So what happens to his legal troubles? Let's set aside the impeachment inquiry for a moment now that he's stepping down.
Well, the cape of wearing of being the governor of New York, whether it's on him or not, doesn't impact him from a criminal standpoint as it relates to these specific allegations. So as far as the Albany County Sheriff's Office, which is looking into that criminal complaint that you mentioned, Savannah, involving an executive assistant in his office who has since come forward and spoken about what happened, that she was groped by the governor, the Albany County District Attorney's Office, along with the Sheriff's Office, they'll continue to look into that. Several of the other district attorney's offices have come come out and said, hey, we're going to still look into things. What you have outside of the Albany complaint that you referenced is a couple of different district attorneys' offices that looked at that AG's report, said, OK, there might be some things here that happen within our jurisdiction that we should look at and figure out whether or not there was a violation of criminal statute. So that's where those investigations stand.
And Danny, now the New York State Assembly hasn't backed down, though, from its impeachment inquiry. And we have to keep in mind all of the things that was related to this sexual harassment scandal, which we heard the governor address yet again yesterday, disputing most of those allegations, but also his book deal to see if federal funds were involved there, nursing home deaths and the miscounting of those, and the funding of the Mario Cuomo Bridge. And again, keeping in mind that impeachment is one of the main tools that it provides is the fact that it precludes somebody from being able to hold office again. So in your opinion, do you think that's going to move forward? And what work do they need to get done to actually write articles of impeachment?
If we were betting on it, the odds diminished significantly of impeachment once the governor announced he was stepping down. Now, in theory, they can still go through with it. We learned earlier this year, at least in the federal system, that an impeachment can move very quickly if the Senate and the House are motivated enough. And because impeachment really doesn't have the voluminous books of procedure that we have in court, it really is up to the individual politicians as to how fast they want it to move forward. And I would just add that by my statistics, the last elected governor of New York to not resign was George Pataki. Now, the great Tom Winter can fact check me on that, but I believe that's correct.
I heard he's right from our other mic. All right, Tom Winter and Danny Ceballos, as always, thank you for your expertise here.
MSNBC anchor Yasmin Vasugian joins us now from the state capitol in Albany. So, Yasmin, this resignation came with little notice yesterday. Many thought he was maybe going to keep fighting this for a bit longer. Do we know what the tipping point was for the governor?
I think, Joe, what we're hearing from some of the sources that I've been speaking to as well in my reporting up here, it's kind of been a confluence of factors, right? You think about the timeline leading up to what happened yesterday. You had the resignation of Melissa DeRosa, his top aide, someone who has been with him for a very long time, very much a part of his inner circle. That was kind of a signal as to the fact that even members of his inner circle were starting to abandon the governor. You had Brittany Camiso speaking with CBS News, obviously an accuser of the governor's, asking for him to step down. You had Roberta Kaplan, the chairwoman of Time's Up, stepping down from her position as well after advising Cuomo when these accusations first surfaced. And then you had the Speaker of the Assembly on Monday saying it's not going to be months. It's going to be weeks that we're going to be pursuing this impeachment process. So I think at the end of the day, the governor essentially was talking about the fact that he didn't have much time left and felt as if the time was now to resign. Here's what the governor had to say yesterday.
It is your best interest that I must serve. This situation, by its current trajectory, will generate months of political and legal controversy. That is what is going to happen. That is how the political wind is blowing. It will consume government. It will cost taxpayers millions of dollars. It will brutalize people.
So I think the question is now whether or not the Assembly is going to continue to pursue impeachment proceedings. Some folks of the Assembly, members of the Assembly that I've been speaking to, have said they want to continue. Others have wanted to stand down. So I think the next couple of days are going to kind of give us an indication as to what's going to happen there. Obviously, with Tom, you were talking about the criminal investigations that are still proceeding. But really, for the governor right now, in the next 13 days, he's got to find a place to live, Joe, because he has been living exclusively at the governor's mansion while he's been in office, and he really doesn't have anywhere to go. So we're going to see how things play out over the next couple of weeks with just 13 days left in office for this governor.
Yasmin, let's talk about the president's reaction. President Biden was asked about Cuomo's resignation yesterday. As we noted a moment ago, he said he respects the decision, but he was asked a number of questions, probably the last thing he wanted after the Senate passed the infrastructure deal. What else did the president have to say about it?
It was quite some timing, wasn't it, Jill? Right? I actually tweeted about this yesterday as I was anchoring the 2 p.m. filling in for Katie Tur. The fact that they were passing this massive bipartisan infrastructure deal in Washington at the same time as Governor Andrew Cuomo holding this press conference and announcing that he was resigning in 14 days' time. We know the president obviously had come out and said that the governor should, in fact, resign. He was, let's not forget, he was campaigning on behalf of this governor back in 2018 before he even decided to run for president. Nonetheless, of course, the president during his press conference yesterday, when kind of taking his victory lap or the beginnings of his victory lap for this infrastructure deal, asked about his reactions to the governor resigning. Here's what he had to say.
Thought he's done a hell of a job. And I mean, both on everything from access to voting, to infrastructure, to a whole range of things. That's why it's so sad.
So here's the thing. There was a lot of back and forth. At the same time, he said, yes, this was the time for the governor to resign. But after he said it was a hell of a job, he had a little bit of a back and forth with reporters who said, wait, you think he did a hell of a job after 11 women accused him of sexual assault and harassment? He said, that's not the question you asked me. You asked me about how Cuomo dealt with infrastructure in his state, how he was governing in his state. This is my response to that. Do I think the governor should step down? Absolutely. I think the governor should, in fact, step down. And these women should very much be believed, especially after that damning 165-page report released by the Attorney General, Joe.
All right. Yasmin Afsugian reporting from Albany. Thanks so much. Hospitals across the South are reaching capacity once again as the Delta variant spreads out of control. Mississippi has consistently ranked in the bottom 2 states for COVID vaccinations, and now the state is running out of ICU beds. 90% of hospitalized COVID patients in the Singing River Health System on the Gulf Coast are unvaccinated. Statewide health officials say 97% of new COVID cases are among the unvaccinated. As the state struggles with another coronavirus wave, healthcare workers are battling burnout. They're caring for younger and sicker patients and dealing with the reality that some people will never get the shot. NBC News correspondent Ellison Barber joins us now from Ocean Springs, Mississippi. Ellison, I know you visited 3 hospitals in the area. What are they dealing with right now?
Yeah, all 3 part of Singing River Health System, all 3 of them at or near capacity. This hospital, when we came here this morning, there was an ambulance waiting in the bay. I went and asked them if they were holding for a bed, and they were. They'd been waiting 30 minutes to try and get a patient admitted. They said they took the last available bed yesterday. They said they had to literally put gurneys with people on the walls in the emergency room and have someone go up and down, an EMS worker go up and down and monitor heart rates because there were no beds, no space available. We spoke to one doctor at this ICU working on the COVID ICU floor, and he said that he has had conversations with patients, one who did not want to get vaccinated and told him she would rather die than take the vaccine. I spoke to a respiratory therapist who spends nearly every minute of her shift by the bedside of many of these COVID patients on the ICU floor. And she talked about what she sees, what they say the moment before they are intubated, and how heartbreaking it is to look into their eyes and, in her words, know that this could have been prevented. Listen to what that doctor and that respiratory therapist told us.
What are they, when they can speak, what are they saying to you? Do they regret?
Please don't let me die. They regret not taking the vaccine. I've had multiple people tell me that they wish they would have taken it. We've had a patient say, tell my wife that she needs to take the vaccine, and that he wished he did.
This was early June, and what she told me was that she didn't want to do it because her mother had had some adverse effects. And when I pursued it and said, you know, it doesn't matter what those effects are, you still need to be vaccinated. And her words were, I would rather die than get the vaccine. And when that happens, you can't say anything else.
One of the things I kept hearing from the doctors across this hospital system, the nurses, the respiratory therapists, is that they understand that some people have questions and concerns about the vaccines, that it is not crazy, it is not ridiculous to have questions, but they say that it is a mistake to not try and find answers from reputable sources. And that's not on the internet, that's not social media, that is doctors who specialize in this, who are working on the front lines every day treating this virus, and they feel like far too often people in this community, in this state, are trusting what they see on the internet instead of coming and asking them any questions that they might have. Joe?
Ellison, it's hard to wrap your head around that comment. I would rather die than get the vaccine. And I know it's got to be hard for healthcare workers. They've been battling this virus for a year and a half now. The vaccines were supposed to be the light at the end of the tunnel, but now that tunnel just seems to keep getting longer with hospitals overwhelmed again. What is the impact of all this on the hospital staff?
It's devastating. I mean, it is hard to put into words. They talk about how they struggle to come into work every day and keep dealing with this again and again, people not listening to them. They feel like people do not care about their health when they're trying to do everything they can to save their lives after they get COVID-19 and get really, really sick, and after other patients are unable to get beds because they are at capacity. They are working way over what they normally would work in terms of shifts. They are burnt out. And we met one ICU nurse who, she's done this for years, and she was working one of her last shifts. She said that she just cannot take it anymore. She cannot take watching so many people die. And she's asked and is receiving a transfer to a different floor entirely. Here's what she told us.
Really, I don't have any strength left in it. Honestly, I've given so much, I can't keep going. That's why I decided to move to a different department, because it's affected me in ways that I never thought possible, and it is not going to get better, and I have to protect myself and my family and my sanity, because if, you know, people aren't doing what they need to do to protect us, and, you know, we're human. We're not robots. We're not machines. We can't continue to do this forever at this capacity.
90% of the COVID patients at this hospital and the other two hospitals in this system are unvaccinated. Joe?
All right, Ellison, very powerful interviews. Appreciate your reporting. Thank you so much.
Dr. Bob Lahita joins us now. He's a professor at the Hackensack Meridian School of Medicine and director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Lahita, thank you so much for being here. And I want to pick it up with what we just heard from that nurse describing the incredibly difficult last year and a half, specifically saying, I can't keep going. We know that one of the things that can stop so many people from ending up in the hospital is the vaccine. But let's talk about what can be done in these healthcare systems to take care of staff and combat burnout. If people are going to continue to be hesitant about the shot, what can be done to support our doctors and nurses?
Well, we can try to support our doctors and nurses, but remember, Savannah, there's only a limited number of intensivists and intensive care trained nurses. And you may recall in 2020, during the pandemic, we imported nurses from the West, from Colorado, from California. Now that the Delta virus has gone throughout the country, particularly in the Southeast and the Southwest, it's a big problem. I cannot believe that in this day, people are dying without vaccination. And it's extraordinary. It's emotional exhaustion. It's a feeling that you haven't accomplished anything, because it's like being on a treadmill over and over, seeing the same kind of catastrophe, intubation, death, inability to have the patient talk to his or her relatives except through an iPad. I mean, can you imagine that? No. So it is emotionally draining.
Yeah, emotionally and physically, most certainly. Now, Doctor, where Ellison was there in Mississippi, the Department of Health for that state, last week's COVID numbers show that nearly 1,000 students tested positive for COVID, along with 300 teachers and staff across the state. So, of course, this is a concern as it's back to school season. Do those numbers surprise you, or do you think we're going to see similar trends as more students in more states head back to the classroom across the country? And then what's that going to mean? Schools closing again? What's going to keep kids safe?
Well, keeping kids safe, number one, will be having all of the teachers and ancillary staff vaccinated. And in fact, I think it should be mandated for school teachers and staffs in schools to be vaccinated, just like it's mandated for us healthcare workers in hospitals. You're dealing with kids that are unvaccinated below the age of 12, for example, and we're asking them all to wear masks. How realistic that is, I don't know. I don't think it's very realistic. And then above the age of 12, you've got a very volatile population of young people who depend on their parents' guidance to be vaccinated, and oftentimes their parents' permission to be vaccinated. And the parents don't believe in the vaccine, they're not going to get their kids vaccinated. And this is really a tragedy, because you're right. In the Mississippi school system, there's over 1,000 kids that are now positive, teachers that are positive. It is a mini pandemic of the unvaccinated in Mississippi, and that's a disaster.
Now, Dr. Lahita, President Biden has a new pitch for getting people vaccinated. It's specifically warning of the impact of the upcoming hurricane season on the fight against COVID. Let's listen to that first.
If you wind up having to evacuate, if you wind up having to stay in a shelter, you don't want to add COVID-19 to the list of dangers. The more we do to prepare, the better off we are when disaster strikes. We can't prevent hurricanes making landfall, but we can prevent people from getting seriously sick and dying from COVID-19.
So based on what we've seen so far, do you think that a message like that will be effective for people who are hesitant, or what more can be done at this point to reach them?
Well, Savannah, consider the disaster of having a hurricane come through and having everybody gather together in a school auditorium or a school cafeteria and coughing and sneezing on each other. The vast number of those people being unvaccinated, and then having a major breakout occur during a hurricane where the hospital may be impossible to get to, medications may not be available, and certainly staff may not be available. It's a combination and a formula for a complete catastrophe.
Dr. Bob, as always, thank you for joining us even to discuss these really tough numbers. It's good to see you.
Good to see you.
And now with students heading back to school around the corner and across the country, News Now is doing a deep dive to help you get a full perspective on what COVID could mean for kids and what parents need to know. Be sure to join Aaron Gilchrist and Morgan Radford for a special half hour titled Now in Focus, Children and COVID, this Thursday at 1:30, of course, right here on NBC News Now.
Most of the country is bracing for intense heat waves this week. Places like Philadelphia are expected to hit temperatures that could feel as hot as 110 degrees. That's forcing the National Weather Service to issue an excessive heat warning.
Experts say this kind of heat in major cities can be attributed to climate change and also something called the urban heat island effect.
NBC's Josh Letterman joins us now from Philadelphia, where it'll really heat up again today. Josh, even in the morning, I know it's humid, so thanks for being out there for us. You know, obviously, it gets hot in cities like Philly during the summer, but this is the city's 5th heat wave in just a few months. Temps keep rising. How has the weather changed there over the last few decades?
Well, in a few words, Joe, it's gotten a lot hotter. You're now seeing 5 more days per year hitting 95 degrees or hotter than you did just in 1970. But one of the interesting things is you're seeing that summer days here in Philadelphia, they're now about 3 degrees hotter than they were about 5 decades ago. But the night times are 3.8 degrees hotter. In other words, the nights are getting hotter faster than the days are. And scientists tell us that's a result of the fact that in these cities, it's really hard for the city to cool down at night. You get this heat trapped, and it ends up really pumping temperatures up across the board.
And Josh, I mentioned this thing called urban heat islands. I know it's something that you've done some reporting on. So can you explain what this is that experts are calling that and what it means for the future of cities like Philadelphia?
Yeah, basically the way that we live in cities traps heat in the urban area and makes it harder for it to escape. So you've got less vegetation, less trees, less water that create moisture that cool things down. And then at the same time, you've got all this human-made material like concrete, pavement, and rooftops that actually absorbs heat and then slowly re-emits it into the environment, as opposed to bouncing it off and sort of sending it back out toward the sky. And so as a result, you get this heat that's trapped in during the day. It slowly releases overnight, and it ends up really heating up the temperatures more in the urban areas than even in the areas surrounding it.
And Josh, we're seeing more and more of this, not just in the East and Midwest, even the Pacific Northwest. How can people best prepare for these heat waves?
Well, it's basic common sense. According to the National Weather Service, you want to make sure you're getting a lot of fluids during the day when you're in a heat wave. Also want to make sure to do things like checking on elderly neighbors and relatives who might need assistance during that time. Try to stay in areas that are air conditioned, stay out of the heat. And then, of course, you want to make sure to avoid leaving children or pets in vehicles in this weather or, frankly, in any other. Joe?
All right. Josh Letterman. Josh, thank you so much. Stay cool.
Thank you, Josh.
From a tropical storm warning in Florida to those major heat warnings across the East Coast, we're seeing extreme weather all over the country.
Bill Cairns is here to walk us through it all. Hey, Bill, good morning.
Yeah, good morning. It's amazing how many people are under heat warnings and advisories right now. I believe this is the highest number that we've seen so far this summer. So this is just about the hottest day from coast to coast that we've seen. Heat warnings are in effect for much of the Pacific Northwest into Northern California, and from the Midwest to the Deep South to the Mid-Atlantic to the Northeast and New England. 133 million people impacted. We only have like 330 million people in this country, so we're over just about a third of the people in this country. The hottest days will be today and tomorrow, especially in the Northeast. So as far as the forecast goes today, the number on the right is the heat index today. D.C. will feel like 105, but how about the Midwest? St. Louis, 111. Memphis, 111. And then as we go throughout the end of this week, the peak of the heat will be on Thursday. D.C. has a chance of hitting 100 degrees. And when we factor in the humidity, the feels like temperature, even New York City will be 105, D.C. 108, but we're still the hottest in areas of the Midwest. Notice St. Louis there still feeling like 109. And then finally, we do still have to watch what's going to happen with Fred. It is approaching the Dominican Republic. And as we go throughout the next 2 to 3 days, it'll be near land, guys, so it's going to be kind of weak. It's not until we get to the weekend that it at least has a potential to get a little bit stronger. We'll have to wait and see if it happens, because this one's a pretty disorganized storm right now. So Florida, as of now, it's a wait and see.
All right, and we will be watching that with you all week. Thank you so much, Bill.
Yes.